Hi, I'm Frank Diamond, the managing editor of Infection Control Today. In our upcoming print issue, our cover story deals with what some are calling the unsung heroes during the COVID-19 pandemic. That would be environmental services teams, EVS. How should we go about making their jobs easier? How can we forge better relationships between EVS and infection preventionists, working relationships? My guest today will help us address those questions. Professor Charles Gerba is a professor of environmental science at the University of Arizona. He's also an expert in microbiology and immunology, nutritional sciences, public health, and agricultural biosystems engineering. In other words, in terms of infection prevention, Professor Gerba covers a lot of territory in the hospital setting. Professor Gerba, thanks for joining us today.
Yeah, thank you. Good morning.
So what are the best approaches that you've seen in terms of infection preventionists and EVS working together?
Well, I think it's really trying to understand the strategies and benefits for each of them. I think environmental services, particularly today, is looking for, better technology that they can use to reduce the risk of the transmission, of microorganisms that cause disease in the healthcare environment. I think really working together on different strategies in terms of what is the best products to use, what are the surfaces to treat, and communicating what the risk reduction between the two groups might result from different strategies they might use.
Have you seen, does one example stand out to you that you've noticed? I know you travel around the country, possibly even the world, looking at how hospital systems operate. Have you seen something that really stands out to you as being exemplary in terms of how EVS and infection prevention departments can work better together?
Yeah, I think, there's a lot of technology being developed. And what I've seen, particularly with environmental service departments too, is they're approached by a lot of new technologies. And they really need to develop, I think, good programs with developing and understanding the potential benefits of these products and actually going together and doing pilot scale work. A lot of our work has been with the two groups, getting them together to understand how we can evaluate new technology as it develops and to try to assess whether it's an actual and real benefit to them. I think that's what we're really searching for, I think, between both of them. Both of them are focused, but they need to communicate, because then that's where there's opportunity evaluating, I think, new products as they're being developed for the particular situation of that healthcare environment they may be looking at all the time.
Do you think infection preventionists should actually run environmental services teams? I mean, I know environmental services team now are their own entity. They have their own manager, and that manager answers to the hospital administrators.
Mm-hmm. Yeah, I think there's a reason for, I think, for better communication. What I see particularly, both of them have different perspectives, but understanding and being able to communicate how they can see development of a product and its impact, and being able to develop some kind of language between them to understand that. I think what I've seen a lot is environmental services tend to do things. I mean, everything is, today return on investment. So it has to be couched in that way between both of the groups, knowing that there is going to be additional cost, but there has to be an understanding what's going to be the benefits of that in terms of risk to the patient and the cost of maintaining those services in the future. And that, I think that's really what we need to see. From what we've seen in our own work, there's a lot of technology out there that can reduce the risk of transmission in healthcare environments, but it's getting both parties to understand that and communicate the benefits of both from a standpoint of cost and benefit to the patient, because I think those are really key issues today.
Your answers seem to focus primarily on new technologies. What about new systems, new management systems?
Yeah, I think what it is a lot of technologies which may require additional training for staff, like the use of, let's say, ultraviolet systems are used for disinfection. That takes training to use them properly in rooms and the strategy for doing it. So that's going to require additional training for the staff. or there's other technologies that will leave a persistent or continuously acting disinfectant to a surface. But those need to be understood by both parties in that, and they need to communicate and understand the benefits of those. But that's going to require additional training by the environmental service staff, I think. And I think that's one of the things that's going to be highlighted, that we're going to see additional sophistication needed by the personnel in environmental health service area to deal with these technologies so they're used appropriately and most effectively in healthcare environments.
In general, do infection prevention and control departments and environmental services departments, do they work well together in general, as far as you can tell?
I think it depends on the individual healthcare facility. Sometimes I've seen them work really well together. Some of the healthcare facilities we work with have an environmental health specialists or infection control specialists, particularly dedicated to that full time. And I think that works out quite well from what I've seen, because they have the time and the effort to look at new technology, evaluate technology, and make assessment to communicate that to the infectious control communities of healthcare facilities. I really think that in the future, what you really need is a specialist in infection control, which understands both the environmental health services and also the professional staff that deals with the patients in that. I think that's really critical to communicate that, because in some ways there's a little bit of differences in languages and focus of it. And I think they're really in the future, and particularly in large facilities, there needs to be a specialist in that area to serve in some way in between both groups, because there's different languages and different focuses from what we've seen. In healthcare facilities that I've worked with, it's best if I have one person there that really understands the benefits of certain actions in infection control, and then it communicates them. And they understand, I think the ones I've worked with, both the professional healthcare staff and the environmental service. So they're able to serve as a go-between. And I think that's really a need in the future, is somebody that can communicate with both groups, because they have different focuses, and they really have different languages and priorities that need to be brought together. So I really see that as a need, particularly with large healthcare facilities. They have to have somebody with that kind of focus that can communicate between both groups. Because in my career, I've worked with both groups, and I found it's easiest to work with somebody that's just working only on infection control, and they have a suitable background to communicate with both groups. And then a lot can be done, a lot of progress can be made. And I think much more effective evaluation of different strategies, and that is there. I think that's one of the things I found a lot of time is lack of focus. I've sometimes dealt with the healthcare professional staffs and the environmental services, and I'm confused sometimes who's the decision maker in that, and who's the best person to communicate. And that's why I think in a large facility, that's why it's so important to have one specialist in that area that can communicate both internally and externally with people bringing maybe new strategies to the healthcare environment to reduce the risk of infection transmission in healthcare environments.
It sounds like you're talking about the creation almost of a new position in the hospital system.
Pardon?
It sounds as if you're talking about the creation of a new position.
Yeah, I really think they're needed. I mean, in some healthcare facilities they have, I think you really need an infection control specialist with training and appreciation both from the environmental service department and the healthcare providers that work with the patients in that. At least the healthcare facilities I work, that seems to be the best situation, because they have a focus. They can sit there and they can evaluate the different strategies might be used, innovations in products and systems that can be used. I think you really need somebody who's focused on that to take advantage of progress that's being made in that area. I mean, there's a lot of rapid progress in technology being developed, particularly driven by the COVID-19 issue now. I mean, a lot of strategies have been out there, but now we're having the resources to assess these strategies. And I think that's why it's so important to have a specialist in that area. I think we really need somebody that can communicate well between both groups in the healthcare situation.
Couldn't that specialist, in fact, be an infection preventionist and just with a little bit more training?
Yeah, I think what's needed, I think it can be somebody that maybe has been in infection control. Some of the people I've worked with have largely been in public health departments before and then moved into the healthcare environment and have a a background both in studying outbreaks, infection control strategies, inspection strategies. I think some additional training in how microorganisms are transmitted in the environment, how you evaluate strategies for controlling transmission environments. I think training in that area is important. Most of the people that I've worked with seem to have a very broad training, both from public health department standpoint, outbreak investigation, epidemiology, and that, and also an understanding of interventions. Like a proper disinfection, what types of disinfectant, what types of products are utilized. It's really a challenge for the environmental service people too, to have the background and all that and be able to evaluate in an rigid manner from their own perspective in that. And that's why I think additional training, I think I really, an infection control specialist, if you have it, if we can give it a term, I think is really needed to serve as a bridge between these both groups and dealing with infection control communities in large hospitals.
What's at stake here? I mean, you must have witnessed in your career
Right.
places or hospitals where they did not work well together. What happens?
Well, usually it's been from my standpoint of trying to assess different strategies for infection controls, trying to figure out who's in charge, who would give permission. Like we have a new strategy for infection control, like a new antimicrobial product. Well, who do I go to? Environmental Services? Do I go to the Infection Disease Control Committee? What professional committee or individual do I talk to communicate potential benefits or strategies that we would suggest or life studies would do? I found it challenging in dealing with how to find out who's really the decision maker and the best person to communicate to. And we want to come in and do an intervention. A lot of my work is looking at interventions, what are benefits in that. And it's difficult for me to figure out who is really the person to communicate with. And that's why I think an infection control specialist is an easier person to deal with. That way I know which person to go through to. And they're focused on infection control. Environmental services has a lot of areas they have to deal with in the hospital. And so they tend to have to focus many different ways. And a lot of times I found they're overworked a lot of the times in trying to deal with them and talk about a specific strategy that might be a benefit to them. So that's why I think a specialist is more needed today more than ever, particularly given all the technologies that are getting developed today. I think it's really important you have somebody who can sit down and spend time in evaluating these and what's the benefit. Because I think in the long term, that'll give you the best return on investment if you have really somebody that's really focused on this rather than randomly selecting strategies that might be done or evaluating them. You have somebody there that can deal with it and deal with all different groups that might be involved in infection control and environmental services within a healthcare facility.
When you say your role is mostly intervention, does that mean the hospital will call you in and say something's wrong here, we're not doing infection prevention right here, tell us what's going on?
Yeah, I think a lot of times what happens is what's new strategy can we use? The number of cases are increasing, like C. difficile is a classic example. So what strategies you can use? Because that's an organism they hadn't necessarily dealt with before. It's a spore-forming organism, so the strategies may be different than have been used in the past. So it's usually an increase in a new pathogen or an increase in awareness. Sometimes what it is additional testing is done in a facility and they realize they have more of a problem with one organism than they previously thought, or they're concerned about one exposure route. So largely I think it's a real challenge in healthcare that won't go away. We're always going to have another organism coming in around the corner that we have to deal with that we didn't deal with before. And so it's going to be a continual evolution of strategies. And I think we saw that with COVID-19.
Anything else you'd like to add about how EVS and infection preventionists could work better?
Yeah, I think what I would say to them, it's an increasing challenge for them and will be an increasing challenge. That's what I found in working with the environmental services. There's always a new need, like COVID-19. Suddenly, protective gear, professional protective equipment becomes really a challenge to provide that. And not only that, but clean it. How do we recirculate it when there's shortages in that? I think you have to look to the future. What I would say is plan in the future. What happens is there's a shortage of professional protective equipment in that, or we have to turn around the equipment really fast and ensure that we adequately provided the needed infection control. I think it's going to take a lot more future thinking by environmental services on how to deal with these things in the future. And they really should develop a strategy for the next crisis we deal with the next emerging infection. So I think environmental service people are going to be really challenged in providing the resources they need to the professional staff in healthcare.
Professor Charles Gerba, as always, thank you for being a guest here at Infection Control today, and stay safe.
You too. It's certainly going to be a challenge in the next couple of months.